Hello, ladies. Thank you so much for once again joining me on this one simple step. Today, I have the privilege of interviewing my friend Christine. And as October is Pregnancy and an Infant Loss Awareness Month, it became very apparent that through my friendship with Christine and her ability to share her story, that we need to discuss early pregnancy loss and miscarriages. This is something that affects so many women. Either it's affected you and you've walked through this personally, or someone close to you. Again, awareness of miscarriages is something that we need to do because there needs to be grieving, there needs to be healing and processing through this. So, Christine, thank you so much for joining me on today's episode.
Thank you for having me, Heather. It's a privilege to be here and just come on and share.
Yes, I know it takes courage to share the journey that you've had, but I know that your passion is to honor the life of charity and help other women in this process. So again, I thank you for your courage as well as part of your healing and processing as well. I want to acknowledge the frequency of early pregnancy loss, which some estimates are 10% of pregnancies and others are up to 1 out of 4. A lot of times miscarriages occur, 80% of them, in the first trimester. So this is a lot for women, especially if you're walking through this path in your first trimester or you have gone through this in the past. So let's discuss today a little bit about Christine. I want you to share your story. You have a son, Caden, and your husband, Caleb. And I would love to hear about your journey through this miscarriage. And Christine is also pregnant right now, about 21 weeks. Is that right?
Yes, ma'am.
And so this is her rainbow baby, which again is the life after a loss of a pregnancy. So, Christine, why don't you jump in with your story first?
Sure. So my name's Christine, and I am a mom of a healthy 2-year-old baby boy, and been married for about 4 years now. And so when we found out that we were first expecting the baby that we ended up losing, I was just, of course, all the emotions were there. I was excited, I was nervous, but I was overall just so thrilled to bring in another baby into our family. And I thought, yes, it's about time. We weren't really planning it. It kind of happened at that time, but we weren't preventing either. We really wanted more children. So I was thankful. I was excited for it. Started to, plan, think of names and think of how are we going to announce this, and can't wait to tell those that I love. Started telling my mom and a few others right away even. But then a couple weeks passed and it was fine. It was pretty normal, just like my first pregnancy. I didn't have any complications with my 2-year-old son. And so I just was carrying on about my pregnancy. And really about 10 weeks is what, looking back now at the ultrasounds, what they're showing there is about 10 weeks. I started having some spotting. It was just an average morning of doing laundry and dishes and being a homemaker and caring for my son. And about the second load of laundry, I felt something that just felt different, And so immediately I went to the restroom and it was there. I saw the spotting. So I just started to shake and I started to panic. And really, I hadn't had any concerns up until that point. It was going on pretty normal. So I called my husband and let him know, and he tried to reassure me and calm me down and say, okay, well, call the midwife. Let's take it from there. So I did. I called the midwife, and she, again, tried to reassure me. Spotting is pretty common early on in pregnancy and could be various reasons. So let's not panic. Let's send you out for an ultrasound. So we did. We went to an emergency ultrasound and did that later on that afternoon. I didn't want to wait much longer, just, all of those things going through your heart and your head. And so when we were there, it just seemed like an eternity laying on that table, and they're looking and looking for a heartbeat. And then, those devastating words that no one likes to hear. Your baby no longer has a heartbeat. And so I just began to break down in tears. And it was such a shock And again, so many emotions, thinking back and reflecting back to that moment. I was thankful to have my husband there with me during that time. And, he was there to cry with me. And it was just really hard to take in that news. But, they wouldn't let me see the ultrasound picture there. It was something to do with protocol because it was an emergency ultrasound called in at that facility. I wasn't allowed to see the baby. So I didn't actually see for myself that there was no little heart flicker there. And the last thing that I remembered was, I remember seeing there was one there. Right. And they didn't show me. So the spotting stopped that day. It didn't return. And so I decided to go home, and I talked over some things to my midwife, and I personally chose to just go through this whole process naturally. And at that point in time, I was actually in denial. So I began to really just kind of question, why is this happening? This isn't really happening. Everything's okay, no cramping, no more spotting. And just went home, and I was so confused that it took about a week between the time when my body physically passed the baby, in between getting that news. So in that week, it just felt like a year. And I just remember feeling so confused and had so many questions and so much hurt. But I was also in a really heavy state of denial, and I was even questioning God. I am a Christian, and I do have faith in the Lord. And I was asking him, how could this be? You're a God of miracles. Heal this baby. Maybe they were wrong. I started to jump on Google. It's always the wrong thing to do, right? I jumped on Google, and I was Googling, testimonies of women who had been had that said to them, and then went back to find out that there actually was a healthy baby, a heartbeat there. They maybe missed it. Technology makes mistakes. Mm-hmm. And so that's kind of what I told myself. I said, nope, everything's okay. And I was just in denial. Well, about a week passed by, and I called my midwife and said, I'd like to have another ultrasound. I want to see it this time for myself. I really want to I want to know. I want to see it. Mm-hmm. I kind of, like I said, I was in denial. I want to see it for myself. So I scheduled that for the following day. It was going to be on a Monday morning. It was the weekend. We had to get through the weekend to be able to be seen at that facility. And I woke up on Sunday morning about 4:00 with cramps. And I just knew something wasn't right. Mm-hmm. And so, I looked over at my husband, and he was sound asleep, so I didn't really bother him. But I couldn't go back to bed. So I got up, and I began to pray and just beg God, no, please no. And the cramps turned into contractions. Oh, wow. It was very interesting. And I began to have contractions, almost like Braxton Hicks at first. And then they really started to hurt, just much like my previous labor that I had experienced. And they got closer and closer together. And sure enough, about 7:30 in the morning, my water broke, and out with that, I passed our baby girl. And again, it was just so devastating, especially to come from, I was in denial, and then to wake up and I really did think I was going to go see that baby's heartbeat the next day. So, it was just so hard. And I was able to go through that, though, with my husband there that Sunday morning. And I'm thankful that I did it at home and was able to go through that. But the following days were so dark. And I actually ended up falling into a postpartum depression on top of a heavy grief, the things that I had seen. I don't regret going through it the way that I did. I'm thankful I got to see and hold our little baby. But, you can't erase some things that you see. Right. And so for me, it was just really hard. And I just remember laying on the couch, and a whole day would go by, and it was like I was just in such a deep, dark spot. And about, a month passed by, or almost a month, and I realized what was going on, with the help of some loving friends and family. And I began to come out of that from, I was able to actually treat myself at home with, holistically, with some essential oils and plant-based products, and correct my hormone balance there. And I just remember a huge dark cloud was removed, and then I could really begin to grieve properly and think more clearly in that way. So I started journaling, and I started just praying and really diving deeper into God's word, and a few things that really helps me through that process. And then I had the idea of, well, I think that I want a baby even more now. I really do. Now that I had lost a baby, I wanted one even more. And I know one baby can never replace the life of another. And that can't be. And so I knew this baby wouldn't take away all that pain and hurt if I were to have another one. But I also kind of had this thought in the back of my head, well, it should help a little bit, right? It'll help me with this whole grieving process. I'll have something else to pour my love into. And so we began trying for a baby, and we actually were able to conceive pretty quickly. Again, I was doing a bunch of things with vitamins and essential oils and prayer and eating right and things like that. And so I had stayed on a prenatal, and I think all of that really helped and played in an important role in us being able to conceive so quickly. But it really didn't make all the hurt disappear either.
Right.
So I began to just continue on with this pregnancy, but I also still mourn and grieve the baby that we have lost. And that's kind of where I'm at now. And there are several things that I have learned to do that do help with that. But that's where I'm at right now. Is now we have our next baby on the way, and it is a rainbow baby. And I love that idea of a rainbow after a storm. And sometimes I have, you see this picture of like the rainbow coming out of a storm. I was actually driving home one day from being out of town, and there's this big storm that was going on behind me. And it was just such a moment that I had just with the Lord, because it was so dark behind me. But then in my rearview mirror, I saw the prettiest, big, bright, beautiful rainbow shining through that storm. And then, that was all going on kind of in my rear view. And I look out the side mirror, and there was the silver lining cloud, almost like resembled heaven. Yeah. And I looked in my other mirror, and I could see my 2-year-old in the back seat. And it was just so interesting, because I felt for like the first time I had all 3 of my children with me. I had that rainbow resembling Charity Hope. And then, like the kind of like the silver lining clouds, where I just knew like Jesus was there holding my baby girl with me, and I could see my baby in the back, and I had the one with me in my belly. And I just knew that moment that everything was going to be okay. So that's kind of my testimony in a nutshell.
Yes. And thank you for sharing so much. Thank you for sharing from your heart, because that's a deep place. And I know women that are listening right now can relate to different aspects of your story and say, yes, I had that moment, or yes, I had that same feeling. So letting women know that they're not alone. And a lot of these things have happened to so many women. And it's very helpful that you've talked about physical healing, emotional healing, and spiritual healing, because all of those need our attention at different times and places, and they work together for the healing. What did you do with some of the unanswered questions? I know that we tend to always go for why, was it my fault? Those types of things. How did you process and handle some of those questions?
Oh, well, Heather, that's a really tough one, because I like to know why. And I told you early on, I was in denial because I didn't even see it for myself on that screen. And I had so many questions and so many unanswered questions, because I was now 1 in 4, and I didn't like that. I didn't like that I was another one of those statistics. I felt so
Mhm.
ashamed, and like it was my fault, and maybe I could prevent it, and maybe this, maybe that. So many questions. And you know what? At the end of the day, I just had to come to the realization that I'm not going to know this side of heaven the answers to
Mhm.
everything.
Mhm.
Um, what I do have is, again, as I am a believer, I cling to the promises instead.
Yes.
And I've just kind of redirected my thinking to do that, because I can get so stuck in asking questions and
Right.
wondering why and blaming myself, and it just always sends me down a negative path
Right.
of blaming God, blaming others, blaming myself, and I don't want to be that way. So instead, I reflect on things that are true, and just the promise that I have, that I know I'm going to see my baby girl again.
Mhm.
And things that are true, like there really was nothing in my control that I could do, according to my midwife and others, that
Right.
could have saved this baby's life. Um, and so having a few of those things to think about really helped me through those why questions. But I honestly, personally, and my advice would be to others, is try to stay away from those why questions, because they really just cause more hurt and cause more
Mhm.
damage than anything. And sometimes we're not going to know why. Now, on the other aspect of that, there is one part that I did um, I did like to know. I did think it was a good reason to ask why, as far as um, well, I don't want this to ever happen again. And I know sometimes there are things that are just out of our control, but I did learn in a few of my why questions how to better take care of myself and my health and my hormones to support a future pregnancy. And I learned things like, why are the risk and the rate of miscarriages going up so much? And it helped me to become more aware of things such as chemical exposure and our diet, and things that, you know, kind of are in our control, that I need to be aware of. And then even with the hormone balance, just learning that there are specific hormones early on in pregnancy that you can be aware of, that you can give your future baby a better chance at survival even early on. And I was able to learn that through a couple of my why questions.
Wonderful. What are some things that you changed for this current pregnancy then? What are some things that you learned that you actually did change?
So some things that I learned was progesterone is a key hormone in miscarriage, and many women will often miscarry a baby because they don't have that progesterone to the level where it needs to be to support a pregnancy. And so, knowing that and speaking with my midwife, I really began to, as soon as I found out, because, you know, we were trying for this baby, as soon as I found out I was pregnant, I scheduled an early appointment. And you
Uh-huh.
can do that if you've had a miscarriage in the past, or even if you want that reassurance and you don't want the anxiety to be there. You can ask your caretaker for an early appointment. And so that was one of the things that I learned, and I did. And then I had my hormones tested, and it's done very simply through a blood draw, and it's not even that pricey for the labs to run it. So I personally think every woman should have one to check their progesterone levels. And and you know, right away we found out that I needed help this time around with progesterone, and that kind of hurt a little bit to know, because you know, you fall into that rut of why again, and maybe I could have helped the last baby if I would have known this sooner. But it's not proven because I didn't have that blood test. But now what is proven is I can share that testimony to help future women with their pregnancies and let them know, hey, take that simple step to schedule an early appointment. Women, just in today's day and age, like I said, the risk is going up, and they're finding more and more and more are being affected with hormonally with their progesterone levels being really low due to everything that's going on with our chemical exposure and our diets today in America. So that's something I did different right away, and has made a huge difference. And I was able to help a few other friends since too with their pregnancies, and has made a huge difference in their pregnancies as well. So I know it and I believe it to be true. And I just share that with everyone now.
That is fantastic. You also have helped women, you said, with fertility. So, can you give us just a short little tip? And people can contact you also on Instagram. Is that right?
That is right. I have an Instagram page, Live, Laugh, Love Lavender, where you can find me, Christine Jacobson, and I would love to speak to you more about this, because this is my passion, and I could go on all day about it. But I will let you know, I have a oil protocol that I do now with oils and supplements, and it does support things specifically geared towards your cycle, your menstrual cycle. So when there's certain times in your menstrual cycle when you have to support ovulation. There's certain times when you have to support fertility, and then from there on, you have to support the ovaries to be able to have that baby implant. And there's different things that you can do for that. So that's something that I'm aware of, and that I put into practice early on, and was able to carry this baby with now.
That's beautiful. Can you tell me, people are very well intentioned, but sometimes they say things that hurt. And I know if somebody's listening here has walked with a friend or a woman that has gone through a miscarriage, and that's that awkward moment of, I want to say something, and if I open my mouth, I feel like I'm just going to put my foot into my mouth. So can you share some of the things that maybe have helped that people have said, and some things that have hurt you?
Oh, yes. So again, so many have the right intention, but just the wrong thing to say. And often I find that those are the ones who have never experienced this kind of loss themselves. And phrases like, "Oh, honey, you're so young, you'll have another one." That just shouldn't be said. It does hurt, because especially when you're in that moment of grief, you don't want to hear something like that. What really helped me personally was knowing that I am going to see that baby again, and telling me that things like, she's in heaven. Not saying she's in a better place, that may be true, but again, it's kind of hard to hear, because I wanted to raise her, and have her with me. So, but being reminded that I'll see her again, and then also being reminded that it wasn't my fault. I had a couple friends who had experienced this as well, just look me in the eyes and hug me and say, "This was not your fault. You cannot blame yourself." And that was really good for me to hear. So maybe saying something like that, and just hugging them, and maybe you don't even have to say something at all. Sometimes it's just being there and showing you care is really sweet. I did have a friend stop by my home after my miscarriage, and she brought me a lovely bouquet of pink flowers. And she said, "Pink is the color that resembles motherhood, and you are still a mother to that baby." And that just meant the world to me, to know that I'm still a mom. I have some friends who weren't as privileged to have another baby, and they lost their first. But knowing that they are still a mom to that baby is just so comforting.
Most definitely. What are some things that have helped you grieve and process? I know you've said journaling has helped. Essential oils have helped as well. Can you share a little bit more about that?
Yes, so surrounding yourself with people who do love you and care about you. I'm privileged to have such a supportive, amazing husband, and he did help me through, and would pray with me and sit there while I was crying. He's not quite the crier, but he would be there with me through it, and some friends, like I mentioned, who stopped by. But what really helped me was journaling, and writing out just prayers, and my story and my thoughts, and just all that I was going through, instead of like holding it in and just becoming more sad. I mean, I was sad, but just sadness can easily turn into bitterness if we just let it sit inside us. So you mentioned that our emotional and our spiritual health is just as important as our physical health, and I believe that too. So I would journal out prayers, and then honestly, I think it's okay to talk to your baby. And so I would talk to Charity, and I'd let her know that I miss her and I love her, And I'm not quite sure how heaven works, but I feel like she could hear me. And if not, I told God to relay the message to her.
Ah,
And that really did help me, just being able to talk to her and about her openly in a journal. Really, really helped. And then again, with the essential oils, I did have several that just help so much with your emotional health, and has made a huge difference in my recovery that way.
and you said that you had a hard time getting the image out of your mind. And when you went to sleep or you closed your eyes, you would just see the picture of your baby, little
Mm-hmm.
Charity. And you said that went on for quite a while, and then there was an abrupt change. What happened?
Yes, so I did have that in my testimony that I think I've mentioned before, where I just I every time I laid down at night, especially those couple months early on, I would just close my eyes and I could do nothing but see my adorable little 2-inch baby, it kept me up all night. It put me down a spiral of tears again. But I was actually gifted an essential oil that I didn't know much about, called Release. It's through Young Living, and a friend of mine gave it to me and said it had really helped her through a grieving time in her life. And so I said, okay, why not? And I would diffuse that at night and apply it and breathe it in. And it really did make a difference. From that moment on, I could actually sleep.
Wow.
And I began having, instead of nightmares, good dreams, or no dreams at all that I could recall. And I was able to just kind of not have that mental image in my head every time I closed my eyes, and that was made all the difference.
Uh-huh. Definitely. And again, the healing, there's steps of healings and processes and so many different aspects that play into it.
Hmm.
Tell me, how did you acknowledge the life of your daughter?
So to me, life starts at conception, and I think it's important to acknowledge a life no matter its gestation. And so there are a few things that we did, because we did have our baby's body. We chose to have a memorial service and bury her in a backyard place that we really enjoyed going to as a family. And so I was going to announce our baby on social media to the rest of the world, who I hadn't already told yet, the same week that I lost her. And in that announcement shoot, we had actually a bundle of balloons, of heart balloons, because we were going to announce it in February. And so we had some heart balloons. And those balloons were actually still in my home at that time, because it was the same week we were going to announce her. So we took those balloons and we kind of put together a little casket for our baby, and we gave our baby a name. Our baby's name is Charity Hope, and I just love that because charity means love, and she was born in February. And even though it's such a sad thing, I wanted to remember that she just resembled love to us and to our family, and that we could still trust God and His steadfast love as well. And so I didn't want all of that kind of taken away. So I thought Charity was a great name, and then Hope, because we do have hope that we will see her again, and she is still our daughter, and that just gave me hope through that whole process. And so Charity Hope is the name that we gave her. And so we did give her a name, and we even have a birth certificate for her that was gifted to me by a friend. And that was such a sweet gesture, but it really does help memorialize that we did have a baby. And so that was special. And we let go of those same 4 balloons after we buried her. And my husband had a few words to say. He read some scripture, and my little boy was there, kind of clueless to what was going on, but it really helped me a little bit to just have that little bit of joy going on of him letting go balloons and smiling, even though it was such a hard time. And I'm thankful that we could really do that as a family. It meant a lot to me to remember her and memorialize her life in that way. So that's kind of what we did to remember her by.
That is beautiful. And I know everybody processes in a different way.
Mm-hmm.
And I know that ladies, if you've gone through this, you're saying, well, we did this, and it's not a right or wrong. It's what you need to do through
Mm-hmm.
that process. And there are also things that you can do later on, especially if a woman's watching this too and saying, oh, we didn't do anything. That was years ago. We didn't talk about it. Again, healing can go through the many, many years. So even
Mm-hmm.
if it's not a new miscarriage and you're still hanging on to it, there could be some healing aspects that you need to work through. And that could be with a professional counselor or a therapist or family friends as well. So don't dismiss that and feel like, well, my time is ended. I should have done that within the first year when it was new.
No, it's not ended. And I do want to also mention not everybody gets the privilege of having their, the physical body of their baby there to go through that. And not everybody wants to, and that's okay too.
Right.
But you don't have to, it could be years later. You can go get yourself a balloon. You could journal. And even I was gifted several months later a necklace that has the name Charity Hope on it. I'm actually wearing it right now.
Yeah.
And people are, they read that and they ask about her. And I have a chance to share her again with the world because I want people to know about her. So all those little things that you can do to just memorialize the baby, I think help no matter how later on you have to do it.
Definitely. Definitely. We talked about this a little bit earlier, but physically, how did you heal?
So physically, that was again really rough because my body did mimic much like a labor, and so it just sometimes it takes time, and so it did take time. And early on, I didn't really take care of myself right away. In that first month, I was again, I said how I just kind of went into like a postpartum depression, and I didn't really take care of myself. But when I finally did start to take care of myself, the healing started physically as far as taking the proper vitamins and using certain essential oils to help balance out those hormones again, and supplements to help balance out those hormones. And it really did help me physically recover from all of those hormones and everything that was going on, and able to just recover that way.
Beautiful. How long did you wait before you started trying to get pregnant again? Because I know some women, doctors advise them to wait a certain time. Sometimes it's 6 months, sometimes it's a year. Every woman is different, and that's why you really definitely need to talk with your doctor who understands you and your body and your miscarriage. So what was the process for you and your husband?
So we were recommended to wait for one cycle by my midwife. And at that, when she first told me that, I was still only, it had just happened. And physically, it actually took me, again, going back to that question, it took me a long time for the bleeding to even stop.
Mhm.
And I wish I would have known about pelvic floor therapists and things like that back then, because Heather, now that you're in my life and I'm learning so much from you, I realize the importance of that, and that could have helped with healing and recovery even faster. But after, that was the only advice we were given. And so for me, it was just a matter of a mindset thing of, okay, I did want another baby, so we were actually going to start trying right away. And so that's what we did. That's what we chose to do.
Excellent. And again, I let women know too, you can get the doctor or the midwife's approval and say, okay, you can try again. But there's a difference between physically being ready and emotionally being ready. And
Yes.
one may come sooner than the other. So that is definitely a time to look at yourself. And even with, again, medical professionals as well as mental health professionals to help you to know when you're ready. So there is not a time frame, again, a right or wrong, but this is a path that you have to walk, and just acknowledging that too, because then some women are like, oh my goodness, I have a fear, or I can't do that. And then again, processing through that. Journaling is a great place to start, but sometimes you need somebody to walk beside you, which could be your husband or your partner, or again, somebody professionally trained to help you
Mhm.
really sort through these things, because there's not something wrong. We need help. We can't do this alone a lot of times. So
I agree.
how has your miscarriage impacted this current pregnancy?
So it's impacted it in every way. my first pregnancy was smooth and had no complications. So after losing that baby, this pregnancy is just so different. Really, when you have a pregnancy after a loss, you kind of lose the innocence of pregnancy, the innocence and joy that you once had before. You're constantly on edge, and every time you go to use the restroom, you hold your breath, or every time you get scheduled for your ultrasound, you hold your breath, and things are just a little bit different. And you pray twice as hard and twice as much, and so it really has just affected it in everyday living. And then also the emotional mindset of this baby doesn't replace that baby, and even though I'm having another baby, we waited a little bit longer to announce this time around than we did our previous pregnancies, and that was because I didn't want people to forget Charity Hope. And that was
Mm.
just kind of my thinking in an emotional mindset of, well, I don't want to steal away from her and her life. So I just kind of waited a little bit longer because it affects it so much.
Hmm. Most definitely. And that's a hard thing too, is again, 80% of miscarriages happen in that first trimester. So that's why so many times we're nervous in that first trimester and we don't want to announce it on social media or even tell family members. But on the flip side, we need support because
Right.
this is a lot of stress. We need more spiritual support, people praying for us, and emotional support as well as physical support. So I think that's a hard balance that we have to juggle. I know with my pregnancies, I waited until 12 weeks also. But I've also heard other people say that is the time that we as women need more support. So again, I don't have a black and white answer here, but just knowing there's a balance there. So who can you tell so that you are supported? Maybe not necessarily put it all out on social media. Um, but again, that's a personal preference for each woman and something that you want to process and work through. But
Mhm.
because it's real. So,
It's so real, and it really did help me, even with this pregnancy, to announce it to those that I loved right away. I had a
mm,
circle of friends that I knew really cared about me and had walked through the grief with me, and my mom and my husband, and I told all of them instantly because I needed that support even more this pregnancy than the previous one.
that makes sense. What advice would you give a woman who has gone through a miscarriage recently?
Hmm. So my advice and really encouragement would be it's not your fault, and you're not broken. You don't need to be ashamed. And all the lies that are going to start flooding through your head, really, that's what they are. They're lies, and I would just encourage you to have hope that you will see that baby again one day, and you are a mom. You're a beautiful mom to that baby. And then just encourage you to grieve and tell others and have others go through this with you, and maybe journal it, go see someone professional if that's what you need, and just don't bottle it all up and try to go through it alone. This isn't something to be ashamed about. It's something that you need to be cared for through.
Exactly. Wonderful. Christine, what books have helped you, or what books would you recommend to others walking through this stage of life?
So I've mentioned how I am a believer, and I don't know how you can really go through something this devastating without God and His Word, because it just really does give you so much hope, and that's exactly why we named Charity Hope that name. So God's Word is really my first and foremost recommendation. There's so many passages throughout Psalms, and even the psalmist, he questions God as he is in a heavy state of grief, and he asks God why, and where are you, and how questions and things like
Yeah.
that. So it is just um, you can really connect with that when you're grieving and going through a loss, because you can dive deeper into those passages and know that there are actually some answers for you there. And then another book that I would like to recommend is Dark Clouds, Deep Mercy, Discovering the Grace of Lament. And that's by Mark Frogop. And that is just an incredible resource to help you walk through the different stages of grief. And really, he speaks a lot about lament and how you can, it takes grief to a whole new level, and just how you can really learn how to deal with all of that. And he has a lot of tips and things in there that really helped me through this process.
Excellent. Show us the book again, and what is the name again?
This is Dark Clouds, Deep Mercy by Mark Frogop.
Wonderful. That is, again, very powerful to have another woman recommend a book that has helped her rather than just searching on Amazon for a book. So thank you so much for that book recommendation. And again, thank you so much, Christine, for sharing your story today. Where can people contact you or follow you? Instagram?
I'm on Instagram and Facebook. Instagram is my main platform, or you can email me at livelaughlovelavender@gmail.com. But I'm right there on Instagram again, the same way, Live, Laugh, Love Lavender. And I'd love to connect with you and hopefully be a help and encouragement to you in any way that I can be there.
Wonderful. And again, thanks for listening today. And hopefully this has helped you take one simple step towards health and healing. And if you're looking for more resources, make sure to check out onesimplestep.today. And I have full-length videos and blogs and resources and other wonderful interviews, because women, we're all at different stages of life. But again, empowering you to take one simple step today. So again, thanks for your time and have a wonderful day.